Hello, my name is Brook Ward. I'm the President CEO of the Washington Health System. It's my honor to be back with you once again as part of our ongoing Friday video series where we attempt to give you updates about what's going on in our healthcare world. And of course, like we've done for many months, I want to talk first and foremost about COVID and specifically about the Delta variant. At this point, you know the Delta variant has been detected in all 50 states and is having a big impact around the world. That has prompted some state and local leaders to encourage people to wear a mask in public regardless of whether you're vaccinated or not. In the state of Pennsylvania, they are currently reporting a moderate level of COVID across the state, but of course in Washington and Allegheny County recently, we're at the substantial level of COVID in our community, and that is concerning. Locally, on the outpatient COVID testing side, we have seen for many months somewhere around 1.5% positivity rate. And in the last 14 days, that's jumped up to a little over 3.5%. On the inpatient side, in the last 6 or 7 months, we've been averaging around 3 inpatients for both Washington Hospital and Washington Health System Green combined. Although admittedly, it's ranged somewhere between 5 to 0, but 3 has been our average. So we've had that for quite a while. But last Saturday, that jumped to 9. And today, on Thursday, when we're recording it, it's down to 6. So it's only been 5 days where the numbers have been up and increased, but it is a little concerning. It's too early to call it a surge or a spike. It's too early to call it a trend. We'll monitor over the next couple weeks. But I think what we're seeing is there's absolutely an increase in COVID in our community, and that's resulting in more people in our hospital beds. Now, I think what's also interesting about that, in the last 2 weeks, the number of people who have been admitted, about 60% of them have not been vaccinated, 40% are fully vaccinated. But all of the people who are fully vaccinated have not been as sick and have not needed to go to the ICU. So the number one way to protect yourself, absolutely, is to get vaccinated if you haven't already. Now let's talk about masks and going back to school. At this point, the Wolf administration is not considering a mask mandate for students K through 12 in the state of Pennsylvania. And that's in spite of the CDC's recommendation that all individuals over the age of 2, regardless of vaccination status, wear a mask in public, particularly in an area where there's a moderate risk. But in our state, we're not doing that at this point. And of course, there are some businesses who eliminated mask mandates and now are returning back to that with the increase in COVID cases in our area, Giant Eagle being a recent example of that. And of course, remember, Giant Eagle and other stores have drive-up options, so you don't have to go into the store. But that does exist in our area. And we know we have 2 restaurants in the Pittsburgh area who are now adopting the New York City model, where they're requiring their customers to have proof of vaccination. How many businesses will reinstitute mask mandates or even vaccination proof going forward? We're not sure. But what we can tell you and what we would encourage you to do is respect them. They're not putting those rules in place to insult you or upset you. They're doing that to protect you, their staff, and the community. And I'd ask you to respect that if you want to be a patron of those businesses. And as an additional reminder, remember, all healthcare organizations in the state of Pennsylvania, including the Washington Health System, are still under the guidance and the rules of the Pennsylvania Department of Health and the CDC, requiring all employees, all patients, and all visitors to wear a mask in our facilities at all times. So we're still requiring that 100% of the time to abide by those rules. We'd ask you to do that as well. It has not been a problem, and we continue to encourage you to participate in that way. Now let's talk about vaccinations a little bit. As you know, we're trying to get the vaccination rate up across our society so we can get to the point where our society is safe. Locally, though, here in Washington County, only 50% of our society, of our community, is fully vaccinated. And down in Greene County, it's at 38.4%. So we have some work to do locally. In spite of that, we have not seen an increase in demand. Matter of fact, the demand for vaccinations have dropped off dramatically. So at the end of July, as you heard in prior videos, we closed our mass vaccination clinics that we had open, first starting at the Stout Conference Center, then we moved it to the Crown Center Mall, and then it was back to the Stout Conference Center, the Peters Township and Waynesburg location. All 3 of those mass vaccination clinics are now closed completely. The good news is, though, starting in August, we started doing COVID Pfizer vaccines at 11 of our primary care offices. So this would be all of the family medicine, internal med, and pediatric offices in all of Washington and Greene County. So we actually have more locations for you to get the vaccine now than we did before. The major difference, all of those locations will require you to be scheduled. We don't want to open a vial for 1 or 2 individuals and waste the rest of the doses. So we're going to schedule people in groups to make sure we don't waste any of that precious product. And on top of that, of course, you can get the vaccine from dozens literally dozens of locations close to your work or home in Washington and Greene County. So we're not the only provider. So if you want it, you haven't received it, it's easy to get. And I would highly encourage you to do so. If you're not vaccinated, it is the number one safe and effective way to prevent yourself from getting COVID. And if you do get COVID, prevent yourself from getting extremely sick or even dying. It's what you can do to protect yourself and your family. Secondarily from that, the next thing down would be to wear a mask, and that would apply to both people who are vaccinated and non-vaccinated. So if you're worried about the numbers going up, again, get vaccinated, but at the very least, wear a mask in public to protect yourself. And remember, even if it's not mandatory, you can still wear the mask. You can do that to help protect yourself. Lastly, moving on here a little bit, we're expecting the FDA to formally approve the Pfizer COVID vaccine for formal approval in the coming weeks, maybe as early as this month, maybe as late as mid-September, but it's going to happen soon. And so I hope that will encourage some people who are hesitant to get the vaccine as well. Now, changing subjects. I want to talk a little bit about the 2021 Washington Health System Foundation Annual Clay Shoot. That event is going to happen today, the day of this video. I hope to see lots of you there. I want to thank our sponsors and many of the participants. It's going to be down at Hunting Hills in Greene County. It's an all outdoor event, so it should be very safe for those who want to participate. If you didn't get a chance to sponsor this event or sign up to participate, you can still help. All of the proceeds from this event are going to go to buying equipment or updating facilities at the Washington Health System. You can go to our website, WHS.org, and provide a donation if you'd like to help. Otherwise, I hope to see you there. It's going to be a great event. Lastly, I want to move on to welcoming a few new physicians who are joining the Washington Health System, starting with Dr. Shaylin Koch. He's a new orthopedic surgeon. He's finishing a sports medicine, sports orthopedic fellowship down in Alabama with Dr. James Andrews. For those sports fans out there, you know he is the orthopedic surgeon for all professional athletes who need something important done. Shaylin's going to be joining us in August. We're looking forward to him coming to the Washington Health System Orthopedic Group. It's going to be great. In addition to that, we have Dr. Annie Ronslowski. She's a new OBGYN physician joining our group. She will be the 8th member of that group, so they will now be 7 females and 1 male. And then last, we have Dr. Donnie Hours. He's joining our residency program. He's a family medicine physician who did a sports medicine fellowship as well. He's going to be splitting his time in the family medicine residency Washington location, seeing family medicine patients, and also in the orthopedic office, seeing minor sprains and injuries, items that require that type of service, but not an orthopedic surgeon. All 3 of these surgeons and physicians are going to be great. I want to welcome them to our community and to the Washington Health System. I hope you do as well. Those are our updates for this month. I hope you found the information useful. Thank you for your time. We're going to do our next video on September 3rd. Until then, stay safe.